morning, Marie. I'm Dianna. I'm going to be your CNA today. I'm going to help you get from the bed to the chair. Is that okay? Wash my hands. First thing you do, check ID. Provide privacy. Both side rails up. Only this time, I'm not putting it at a good working height. I'm going to put both side rails up and put the bed at the height of the wheelchair. We want her to be able to slide from here to here. We don't want her to have to be way up here and come down, or way down here and try to go up. So you want side rails up, bed to the height of the wheelchair. That's close enough. I'm not cranking it again. Very first thing I do after I've gone through the principles of care, lock my wheelchair. Because once you get her on the side of the bed, it's too late. Once you stand her and try to move her, it's too late. You can't take your hands off of her to lock the wheelchair. I'm going to lock the wheelchair. Okay, Marie, I'm going to put on your flat supportive shoes. And yes, it's okay to put them on in the bed. Nursing homes have different rules than we do, okay? I do the laundry here. They have someone who does the laundry there. Okay. Marie, I'm going to put the head of your bed up, okay? Because they're elderly, taking them from a completely lying down position like this and expect them to be able to sit up, impossible. They don't have the strength. So I'm going to put the head of your bed up, okay? Whenever you move them, you got to tell them I'm putting the head of your bed up. They get scared. How's that, okay? Good. So I got her flat supportive shoes on. Check yourself. My wheelchair is locked. Okay, Marie, what I want you to do is put your hands on the mattress like that. I'm going to go under your legs. When I say 3, I want you to push the head of your body up, okay? And swing over to the side. I'm thoroughly giving her instructions. You have to do that. On 3, ready? 1, 2, 3. It should be a smooth transition. And unless you give them instructions, it's not going to happen. They're going to stay there as you're bringing their legs around and you're going to hurt their back. You have to tell them what you're doing. Okay, Marie, I'm going to put the gate belt on you. It's okay, relax. Communication is the key.
So this time she's assist because she's helping you.
She's definitely an assist because she's a one-man transfer. If she wasn't an assist, she'd be a Hoyer. Even a 2-man assist. I'm just going to put this around you. Always thread the gate belt through the teeth. See the teeth? If you don't put it through there, it's got nothing to grip. Make sure it's not all twisted. Show that you're being careful. Is that too tight for you? Yes, it's too tight. Not too tight? Too tight?
Too tight.
Oh. Check with them. They're the best person that can tell you if it's too tight. What I usually do is, because they do have dementia, they feel anything foreign around their waist, I'll put my hand here. If it feels too loose, I'm going to tighten it a little bit because they have dementia. I'm going to take my right foot. The leg that goes towards the wheelchair has got to be free. Otherwise, you'll be tripping over yourself. Okay, Marie, I want you to put your hands on my shoulders. And I'm going to take side of the gate belt. On 3, I want you to stand up for me, okay? You have to tell her. They'll sit there. They won't even try to stand up. 1, 2, 3. You okay? Never move them till you ask if they're okay. What if she says, I feel dizzy? Sit her down. Never move anybody who says they're dizzy. 1, 2, 3. You okay? Okay, let's start moving towards the wheelchair. Good job. When you feel the back of the wheelchair with your knees, put your hands on. Good job. You may sit. Okay, I'm going to take the gate belt off, okay? I'm telling her everything I'm doing. If you don't, wait till you get to the nursing home. Mary and Ellis, what are you doing? What are you doing now? What are you doing now? They want to know what you're doing before you do it, okay? Never pull this gate belt out behind them. You tear their skin. Can you sit up for me? Again, communication. She can sit up. No reason for me to pull that gate belt. Okay, I'm gonna unlock your wheelchair. Here's your call light. If you need me, you call me, okay?
Okay.
I don't have to do anything with the bed. She's not in it. Doesn't have to be in the lowest position. She's not in it. She's out of it. I'm gonna remove privacy and wash my hands. At the nursing home, no residents stay in their room. None of them. Because if I leave Marie in this room, she has Alzheimer's, she has dementia, right? I leave her in this room by herself. What do you think she's gonna try to do as soon as I leave the room?
Go back in bed.
She's gonna try to climb into bed. So we take them out of their room and we bring them out to a sitting room. That way they have supervision. They have CNAs and nurses watching them to make sure they're not gonna fall. You understand that? So there's no reason to touch the bed. At this point, if I was working at the nursing home, I'd bring her out to the sitting room. Here, watch some TV. I'd come back, make her bed. Okay? You don't have to do anything with the bed after the one-man transfer. Everybody get that bed?
Got it.
What are the 3 most important things to remember?
The items I have to bring.
The
Lock
luggage,
your wheelchair.
protective shoes,
Flat
and the
supportive
gate belt.
shoes, gate belt. If you forget one of those, you fail because of safety. Safety is a fatal error. Privacy, dignity, even communication may be critical, but safety and infection control are fatal. You cannot make a mistake, okay? Morning, Melody. I'm Dianna. I'm gonna be your CNA today. I'm gonna help you go from the bed to the chair. Is that okay? Wash my hands. Check ID. Provide privacy. Both side rails up. My side rail down. Bed at the height of the wheelchair. And put the head of your bed up, okay? Head of the bed up. Flat supportive shoes. My wheelchair is locked. On 3, I want you to push down on the mattress, okay? And swing your body around. 1, 2, 3. Good job. And put the gate belt around you, okay? Because if you don't tell them that's what you're doing, they're gonna say, what are you doing? What I do is put my hand there, then tighten it. If there's enough room for my hand to fit in there and it's still got a little looseness, it's not too tight. If the gate belt's too loose, she'll know it and she'll say something. I'm gonna put my right leg between her legs. I feel more comfortable with this a little closer. You adjust to whatever. If you know that this lady is really unsteady on her feet, bring the wheelchair a little closer. Can you put your hands on my shoulders? On 3, I want you to stand up for me, okay? 1, 2, 3. You okay? Okay, let's start moving towards the wheelchair. If you don't tell her, she'll just stand there. Okay, when you feel the back of the wheelchair with your knees, you can sit down. Good. Can you sit up for me? Thank you. Gonna unlock my wheelchair. Your call light's right there. If you need anything, call me, okay? Remove privacy, wash my hands. I have to present you with 2 scenarios. Remember I said you're gonna walk in, the bed's gonna be in the lowest position. If I knock on the door, as soon as I see Marie with this Johnny on, I know I'm gonna have to undress her first, right? State lady doesn't care about undressing. That's not important. What's important is that you are aware of her affected side. So let's say Marie has had a left-sided weakness all along, nothing's changed, and she wants me to dress her. What she's watching for is that you dress the affected side first. She doesn't care about the strong side, as long as you dress the affected side first. So I'm just gonna do dressing, because most students I've heard from have said to me, I got dressing. I said, did she have a Johnny on? No, she just wanted me to dress her over her shirt. Kimberly shows up like that, got a dresser, you're gonna put the shirt over her clothes. They don't expect you to take her clothes off. Common sense, okay? So if I got dressing from the state and say pulse, we'll throw pulse in there just for the heck of it. All I'd need to do is get 2 shirts to walk into that room. No other supplies. When we get to Denture Care, nail care, and bedpan, a lot of supplies to remember. These skills, very few supplies. 2 shirts, okay? What side weakness does she have?
Left side.
Again, let's visualize the bed's in the lowest position. The side rails are down, and the head of her bed's down. You see why the state doesn't want to wait for you to put the head of the bed down? You see why they don't want to wait for you to put it up? You see how long it took me to put the head of the bed down? They want to get out of there. So she will say to you, you don't really have to put the head of the bed up, just tell me when you would. So would you stand there like this with the button? Waiting for the bed to go up? You didn't listen. So I'm gonna use that same scenario. I'm gonna leave the head of her bed down. But the state lady told me, you don't really have to put the head of the bed up, just tell me when you would. Those words are very important for you to listen to, okay? Good morning, Marie. I'm Dianna. I'm gonna be your CNA today. I'm gonna help you get dressed. Is that okay? Speak right to the resident. Don't look at the state lady and say, hi, I'm Dianna. I'm gonna be your CNA. Talk to the resident. Ignore the state lady. And I'm gonna help you get dressed. Is that okay? First thing I do? Second thing I do? Third thing I do? Fourth thing I do? My side rail down, head of the bed up. Again, think about transfer. You've got a 100-year-old woman here laying down, sorry Marie, laying down, right? And you want to dress her. How are you going to dress her? You're going to yank her head off if you try to pull her up. Bring the head of the bed up. It's all for the safety of the resident. You know, I was at the nursing home once and someone was doing a Hoyer and they were putting a Hoyer pad under a resident. And they wanted me to help them. They never asked me to help them again. Because when I went in the room, the resident was laying down and they were pulling, yanking her head up. Could break her neck. Put the head of the bed up. It's easier to dress them. Again, it's her left side that's weak, right? Guess what happens if you enter the room on this side? You know you're supposed to dress the side closest to you first, right? You're gonna end up dressing this side first. Whatever side is the weak side, that's the side you enter. Oh, I already did that. So I put the head of the bed up. Okay, Marie, what would you like to wear today? This or this? Nice choice. This arm does not work. She can't move it. So you're gonna get your shirt all ready, roll it all the way up. This arm is heavy. It's not like 2 pounds. Don't help me, don't help me. See what I'm doing with my other hand, my other arm? I'm cradling her arm like it was a baby. I'm not letting go of it because I realize how important it is. If I do, I could hurt her. As soon as you get that on, put her arm down. Fix this side. Now, how do we incorporate independence into this skill? She can use that arm. Can you sit up for me, Marie? I'm gonna get this shirt ready for you. Can you put your arm in? Don't take her arm and put it in. What principle of care did you just wreck? Independence. Put your arm in for me. Let her do it. But get the shirt ready for her. She can use this arm. Why would we not let her? You can lie back. Communication. Good. She's not gonna ask you to button it. She's not gonna ask you to zip it. She wants to see if you dressed the affected side first. Okay? Get that? Okay, would you, because I took her head of the bed from a laying down position, doesn't she have the right to go back down if she wants? I disrupted her position. Would you like the head of your bed to stay up or down?
No.
See how long it takes? They don't want to wait. That is why I've been trying to say to you guys, you've got to verbalize everything, just like I did to you. How's that, good?
Good.
Okay. Nice side reel up. Bed in the,
No position.
both side reels down.
Whole life.
Where am I gonna give her her call light? This side doesn't work. Here's your call light. If you need, place it in her strong side. Call me if you need me, okay? Have a good day. Remove privacy, wash my hands. And document. And would she be assist or D?
Assist.
Assist, you know why?
She helped you with
She
the other
picked
arm.
the shirt.
Yeah.
She sat up for me. She put her good arm in the shirt. She helped you. As opposed to the one who did absolutely nothing with repositioning, right? Most of the skills you do, they want you to encourage the resident to assist with their care. That's independence. It's the same thing as feeding someone who's perfectly capable of feeding themselves. Why would you? Don't take away their independence. This is what the state looks for, okay? Undress her.
Diana,
If I was gonna undress her, I'm not going through all the principles of care or anything.
what about if she was paralyzed and both sides are weak? I mean, are affected.
Then you have to support both sides. It's not gonna much matter.
Yeah.
Hopefully she's got a pullover shirt. She wants me to undress her. They don't give you undressing, you understand? It's not important. What they give you is dressing. So if I were to undress her, hey Marie, same thing. Am I gonna struggle and try to get this out
No.
when she can't use this arm? Hey Marie, take your arm out for me, would you? Take your arm out. You do it. I'm not gonna do it because you're independent. Now look how easy it is to slide this off the affected arm instead of struggling to try and get this arm off first. So this is the scenario. When you undress the strong side first. When you dress someone who has an affected side, you dress the affected side first. I don't care about undressing. Just don't undress the affected side first. Undress the strong side first. And then, if this arm is you've got to understand what it means to be paralyzed. Do you? If I raise Marie's arm, and I don't support it, which is the reason why we support 2 joints with range of motion. If I let go of her arm, she has no control over it. It'll just, she could break her wrist. When someone has an affected side, you need to protect that affected side. See how I cradled it like a baby? Her arm probably weighs 25 pounds. It's dead. It's dead weight. Okay? Salutations. Okay, I'm gonna wash my hands. You don't have to tell her everything you're doing. I turn on the cold water first. Add the hot. That's good. Wrist. Don't touch the faucets. Don't touch the inside of the sink. Friction. Interlace. Fingernails. Your thumb is a fingernail. Fingernails. Thumb. Wrist. Rinse. Never go back. Once you do your wrist, you're done. Wipe from the wrist down. Use this. Never put your hands in the trash. Your hands are clean. I don't feel as though they're dry enough, so I'm going to take another paper towel. You don't pay for them. You don't pay for the water. Who cares? I'm going to take my next paper towel. Turn off the faucet. Use the foot pedal. How would it look if you just washed your hands and you did this?
You need to wash it one more time.
You just blew it. Use the foot pedal to dispose of your towel. From what I understand, there is no sink in the testing room. So in order for her to do denture care at a real sink, she needs to take you out of the room.
Thank you.
So if that's the case, do not do anything to the bed until you come back. We're gonna use the scenario of a pretend sink, because that's what they use most of the time. But if she takes you from the room to a real sink, that means you need the same supplies, paper towel to line the sink, paper towel to line the Amices basin. She really wants you to turn on the water. She really wants you to put the toothpaste on, and she really wants you to brush the
This is for
dentures.
the denture.
Otherwise, she wouldn't be bringing you to a real sink. If she does it at the bedside, you're gonna use your pretend sink. So today, we're gonna use a pretend sink. So, what I was saying before about going to the sink, if you notice, the dentures are on the bedside table. If you get denture care, before you can handle those dentures, you have to put your gloves on because they've been soaking all night in dirty fluid. So I'm gonna do what I have to do, then I'm gonna clean her dentures. Morning, Melody, I'm Dianna. I'm gonna help you clean your mouth and your dentures, okay? I'm gonna wash my hands, check ID, provide privacy. Both side rails up, bed at a good working height. And then put the head of your bed up, okay? Because if you don't put the head of the bed up, they'll choke. How many of you brush your teeth laying down? This is gonna be my pretend sink. So I've gotten all that out of the way. First thing I wanna do is put on my first pair of gloves. I'm gonna be right here doing your dentures, okay? You're not leaving the room. Don't ever leave the room, because if you do, now I need to put side rails up, bed in the lowest position, and both side rails down. But I'm staying in the room. Got my first pair of gloves on. I'm gonna get all set up with everything I need at my sink. The rest of the stuff I need at the bedside. I'm gonna line my sink with a paper towel, because if the dentures fall in there, it's porcelain. Porcelain and latex don't do well together. They break. And if you break your residents' dentures, the state has to pay for them. I'm gonna line my sink and I'm gonna line my Amices basin. Get yourself all set up so you're not confused. I'm gonna turn on the faucet with the paper towel, cold first, then add the hot. I'm not touching these dentures yet. Now I'm gonna remove the dentures. She sees I'm protecting them. Even if I drop them now, they'll fall in the sink that's lined. They won't fall on the floor and break. I put the dirty dentures in the Amices basin. I gotta dump this dirty water that they've been sitting in all night. Rinse it, clean cup. Rinse my lid, clean lid. Now I can put my toothpaste on my toothbrush. Don't do this. They're gonna fall and break. Don't touch them till you have to. Immediately take them from the Amices basin. I'm gonna clean all surfaces. What that means is inside, the teeth, underneath. Rinse the toothpaste off. You rinse your teeth, don't you? Clean dentures, clean denture cup. I'm gonna rinse my toothbrush, clean brush. I'm gonna remove the paper towels from the sink and the Amices basin. They go in the trash. I'm gonna remove my first pair of gloves, wash my hands, put on my second pair of gloves, turn off the water with a paper towel. I'm done with my sink, I'm done with my toothpaste and my toothbrush. Okay, I'm back. I'm gonna mix 1 pot mouthwash, 4 parts water. I'm gonna ask you, could you rinse and spit for me? Good. She's loosened up whatever debris is in her mouth. Now I'm gonna take the swab and clean inside of her mouth, her gums, her tongue. Now we've really loosened up what might be in there. Can you rinse for me again and spit? Good. These gloves are dirty. Remove your second pair of gloves. Wash my hands, put on my third. Clean gloves, clean mouth, clean dentures. Can you put your own dentures in your mouth, or do you need help? Don't make them fish in the cup for them, because they'll drop them. Hand them the top first, and then the bottom. Before I remove my gloves, I want to rinse this out, get rid of everything. No bodily fluids, right? Except what might be on the towel. So while I got my third pair of gloves on, I'm just gonna remove the towel. Goes in the dirty linen. Now I'm gonna remove my final pair of gloves, wash my hands, and finish up. Would you like the head of your bed up or down? Up, good. My side rail up. Bed in the lowest position. She wants the head of the bed up. Both side rails down. Use your call light. Remove privacy. Wash my hands. Good morning, Melody. I'm Dianna. I'm going to be your CNA, and I'm going to help you clean your mouth and your dentures, okay? Wash your hands. Check ID. Provide privacy. Both side rails up. Bed at a good working height. My side rail down. Head of your bed up. I'm going to put the head of your bed up. I'm going to put on my first pair of gloves. I'm going to get my dentures. I'm going to be right here at the sink, okay, Melody? Assure them that you're not leaving the room. Get all set up. Here's my pretend basin. Line the Amicis basin. I'm going to line the sink. My toothpaste. My toothbrush. I got my first pair of gloves on. Take a paper towel, turn on the faucet. Get it the right temperature. I'm going to remove my dentures from the dirty denture cup. I'm going to dump it, rinse it, clean. Rinse the cover, clean. I'm going to get my toothpaste on my toothbrush. Bring it right over to the sink, brush all surfaces. Rinse. Clean dentures, clean cup. Rinse my toothbrush. Clean toothbrush. Trash. I'm going to remove my first pair of gloves, wash my hands while the water's still running, turn it off with a paper towel, put on my second pair of gloves. Coming over to the bedside. I'm going to mix 1 part mouthwash, 4 parts water. Can you rinse and spit for me?
You don't have to rinse that, right?
So you meant this?
Yeah, that's what they
I'm
were
not going
saying.
to touch her mouth with this
No,
towel.
the thing she spits in.
Yeah.
You have
rinse it
to,
when
you
you're
have to
done.
rinse.
Oh, when you're done, okay.
I'm going to take my swab, clean the inside of her mouth, tongue, gums, dirty. Can you drink and spit again for me? Okay, are you happy?
Yeah.
These gloves. I'm going to rinse my Amicis basin.
But she doesn't put her mouth in it.
I'm going to remove my second pair of gloves. Wash my hands, put on my third. Can you put your own dentures in your mouth, or do you need help? Hand them to her.
On the top
Top first, then the bottom.
No, it's on top of the paper. Maybe because it's looking at it, so they see.
Before I can remove these gloves, my third pair, I still have a dirty towel. Dirty linen. Okay, I'm gonna remove my final pair of gloves. Would you like the head of your bed up or down? Up, good. My side rail up. Bed to the lowest position, both side rails down. She wants the head of her bed up. Here's your call light, call me if you need me. Remove privacy, and for the fourth time, wash my hands.
Question now, after you took the third pair of gloves, do you
Off.
have to wash your hands? Yes.
Yeah, I said that. I would take off my third pair of gloves, wash my hands.
Um,
But if you didn't, what are you gonna do, the very last thing you do before you leave that room?
Wash your
So you
hands.
are gonna wash your hands, it's just that you're not exposed to bodily fluids anymore. That's your concern with that third pair of gloves on. Once you're no longer
only
exposed to
failure
that
is
towel and everything's cleaned up, even if you removed your third pair of gloves and didn't wash your hands,
As long as
you're gonna
you-
finish up and then you're gonna wash your hands. You can add the extra hand washing.
It's not a
At
deal
the
breaker.
end.
Yeah.
It's
that's
not a
what
deal
she-
breaker.
She, yeah.
And if you didn't do this, she wouldn't fail you.
Mm.
So let's not get too critical. Let's stick to the 6 principles of care, okay? No one says you really have to daub someone's mouth. You have a question?
Me,
I do too.
so you put your side wheel down before you put the head of it up.
That's okay.
That's okay.
The only
She's still
time,
So
Standing
what's gonna
there.
happen if when you put the head
look
of
at,
it
I
up,
can come in here, no side rails are up, and I can put the head of her bed up.
She's still there.
I just can't move the bed up or down. It's that kind of motion that makes people panic and they get dizzy and they might fall over the side. You do not need to have the side rails up to put the head of the bed up or down,
Okay.
Oh, okay.
okay? So I could have put the head of the bed up first if I wanted to, then put both side rails up, bed at a good working height. To do the head of the bed, you don't need to have the side rails up.
Okay.
And now that you brought up that, don't get too heavy into the side rail crap, because I'm gonna tell you what's gonna happen. You may go there and and there's side rails on the bed. As you can see, there's none here. There are side rails on the bed at American Red Cross. What if she says to you, don't talk about the
Worry.
side rails? Don't even mention them. And don't mention them. Knock on the door, hello, Melody, I'm here to help you do denture care, is that okay? Wash my hands, check ID, provide privacy. I would put the head of the bed up. I would put on my first pair of gloves. Did I mention the side rails? So why would I mention it at the end? Because I didn't even put them up. Why would I be putting them down?
Can we ask them if they don't say anything?
If this is the thing.
Before you start, no,
If
before
you read an
start.
assignment, okay, I don't know if I had it on any of those assignments I gave you guys this morning.
Yeah.
But if you read your assignment, and one of the very first things it says is there is no doctor's order for side rails. What does that mean?
No.
Don't mention
Oh,
Oh,
yeah,
geez.
do put it.
That
Do
means
put
that
it.
you need
Yes.
to
That means you need to address them.
Yeah.
Address.
Because in order to have side rails up on your resident, you need a doctor's order. So unless she specifically says there's no doctor's order for side rails, if at that time you still have a question, you can say to her, so you want us to pretend there's side rails.
Well, we can ask
She's
the question.
human. Ask her to clarify it before you go and do something wrong. So if she says there's no doctor's order for side rails, that means she wants you to address the fact that if you put them up,
Tell her.
and when you're finished, you don't put them down, you've restrained your resident without a doctor's order.
That
make sense?
That means it has to
I
stay
just
up
got
at all
confused.
times.
Yeah. But if she says to you, I don't want you to make no mention of the side
And
rails,
don't mention it.
then don't.
Will she verbally say that, or will that be on the?
It'll
No.
say on there,
Oh, okay.
there is no doctor's order for side rails. That means she wants you to address them. If she gives you the assignment and she says, read your assignment, and do you have any questions for me? That might be the time to say, do you want me to address the side rails at all? Because it makes a huge difference as to you passing and failing. All right, but if they specifically say there's no doctor's order for side rails, she wants to know if you know that there's no doctor's order that side rails can be up, do you know enough to put them down?
If there's an order, we have to keep it up. If there's any doctor's order, we have to keep the rails.
Up at the lowest position,
When it's
yeah.
on the lowest position.
If there's a doctor's order.
Yeah.
You always have to put the bed in the lowest position,
No.
whether you're mentioning side rails or not.
No, she's talking about the side rails.
It's very unusual to have doctor's order to have side rails up. Very, very unusual.
Not really. In nursing homes, a lot of families ask, can they have the side rails up at night when they're in bed for the night because they're worried about them. If the nurse's aide leaves and doesn't put the bed in the lowest position, now they're really at risk because not only are the side rails up, but the bed's in the highest position. How are they gonna get out of that bed? They're gonna climb out and break their hip because you're gonna fall from this distance as opposed to this distance. Okay? So, if in doubt, ask questions. She will give you the opportunity. Do you have any questions for me? Okay, so now I'm gonna go back and I'm gonna document Denture Care. Was she I, independent, A, assist, or D, dependent?
Assist.
Assist. She put her own dentures in her mouth.
Mm-hmm.
Simple as that. If she said she can't and I have to do it, she would be D. So it depends on what the scenario the state gives you. She may say she's unable to put her teeth in her mouth. Or she is able to put her own teeth in her mouth. She's telling you, you better offer her to put them in her mouth. And never let them reach in there. They're unsteady, they don't know which is which, and they'll go flying. So be accommodating and hand her the uppers and hand her the lowers, okay? Everything that has to do with denture care, not only clean to clean, dirty to dirty, like nail care, but don't break those dentures. If you drop those dentures and you break them, what have we just done to our resident? She's gonna lose weight, because we broke her dentures. It's gonna take months
We'll get another one.
to get a new pair.
Mm-hmm.
They're gonna have to change her diet from lovely whole steak, potatoes and broccoli to puree. She's not gonna eat. She's gonna lose weight. So when they watch you do denture care, they see how you really have a good understanding as how expensive those are and how you have to protect them. All right? Okay. Just like we're gonna use a pretend sink for nail care. She's never gonna have you bring the resident over to a real sink. So we pretend. Towel, pair of gloves, orange wood stick, nail file, lotion, pretend sink. First thing I'm gonna do. Morning, Melanie. I'm Dianna. I'm gonna be your CNA today, and I'm gonna help you clean your nails, okay? I'm gonna wash my hands, check ID, provide privacy. Both side rails up, bed at a good working height, my side rail down, head of the bed up. Can't lay down with her hands in the basin. There are 3 skills in which you wear gloves. Soon as you realize it's a skill that requires gloves, put them on. I'm gonna put on my gloves. I'm gonna get warm water, just a little bit, 1 drop of soap. I'm gonna get my towel all set up. Here's my pretend sink. Here's my towel. The only way you can fail this skill is if you put something dirty on your clean side. So my water's warm. Can you put your hands in the water for me? Warm water. Don't just do this. Are you allowing independence?
No.
No. Can you put your hands in the water for me? If she can't, then of course, at the nursing home, you're gonna see they can't. You're gonna have to put their hands in the water. Gonna soak them for 5 minutes. As soon as I remove her hands from the water, I put them in the middle of the towel. Get rid of that. I'm gonna set up with all my clean stuff over here. I just took her hands out of the water. I'm just gonna dab them. You know yourself, when underneath your nails is a little bit moist, it's easier to clean them. So you don't want to dry the hands thoroughly. And I'm going to start with the hand farthest away, the curved end of the stick. Clean, wipe. Don't wait till you get a buildup of germs. Clean, wipe. Clean, wipe. Clean, wipe. Clean, wipe. If I put this over here, you
No.
fail. It's dirty. Goes over here, I'm gonna throw it in the trash. I'm gonna take my emery board and I'm gonna smooth the edges. You notice I didn't say file? One direction, that way, that way, that way, that way. This is dirty. I'm gonna throw it away. Can you lift up your hands for me? I'm gonna remove the dirty towel. Throw it in the dirty linen. At this point, I'm not exposed to any bodily fluids. I can remove my gloves, throw them away, wash my hands. Would you like lotion? Shake it, put it in your hands, warm it, start at the wrist, and work your way down. Don't go between the fingers.
What if some of them ask to put nail polish on their nails?
Yeah, but that's not part of, we do
Oh, you
paint
do?
their nails at the
Yeah.
nursing home, we have a kit. But the state doesn't give you nail polishing, okay? Now, what do I have to ask her? Because I took her from a laying down position where she was very
She wants to
comfortable.
Go back.
Would you like the head of your bed up or down? Up, so she wants to leave it up. Okay, my gloves are off, my side rail up, bed to the lowest position, both side rails down. Use your call light if you need me, call me, remove privacy, wash my hands. Okay? Think you got nail care?
Yep.
The only way you can go wrong is putting something clean on the dirty side and dirty on the clean side. Once you wipe her hands, that becomes your dirty side of your towel. That's where anything dirty or used goes. And you have to tell her how you would dispose of that towel. I would throw it in the dirty linen, okay? So I need a bath towel.
I get called at work.
I need a pad, washcloth, towel, toilet paper, gloves. If you forget and a bedpan. Never ever put the bedpan on here. Matter of fact, if you get bedpan and there's a table anywhere in the area, get it out of the way. Push it away from you. Because if you once do this, or with the toilet paper, or with the pad, you fail. You don't eat on your toilet, right?
No.
They don't either. All right, so I got all my supplies.
And don't put anything in there either.
We can actually put some in the bedroom too.
No, she didn't say that.
Inside.
Oh, yeah.
All right, so this is the actual setup. This is a clean bedpan. It's not been used.
I don't know what's in
I know, but for the case for Dianna, Lydia said that they even made you cover it. The new thing was to cover it when you
Yeah, I
walked in
remember
the
that
room.
part.
It would be even that particular, and you
Yeah,
have to have
but
your
the
linen
real
separate.
scenario is, this is where the bedpan is. Right? If it's the one that they use all the time, so we'll do it that way. Now I don't have to worry about putting anything in the dirty bedpan, do I? I just got my linen. Okay. Good morning, Melody. I'm Dianna. I'm gonna be your CNA today. I'm gonna help you get on the bedpan, all right? Wash my hands, check ID, Provide privacy. Both side rails up. Bed to a good working height. Put on my first pair of gloves. So this side rails up, so Melody can roll way over and hold on. Can you roll over for me? Oh. Come back. You on? Never shake linen, don't do this. And never hold the bedpan over their face. Are you comfortable? I'm gonna put the head of your bed up, okay? How many of you take a bowel move and laying down?
Unless I'm sleeping.
Pee the
So you're
bed.
incontinent?
Get up and you go poop in the middle of the night.
I peed the bed when I was 15.
I sit up when I pee and poop,
I
so.
did when I was pregnant last year.
Is that okay?
My boyfriend was making fun of me.
Okay. Here's your toilet paper. I'm gonna put my side rail up. Here's your call light. I'm just gonna be right here behind the curtain when you're ready, okay? Give her a little bit of privacy. Immediately remove my gloves. If it's a lady in the next bed wants a drink of water, I just put someone on the bedpan. Wash my hands. Put on my second pair of gloves. She's done. Did you wipe? Yes. Always good to check. I gotta put the head of the bed down to take her off the bedpan, because I would hurt her back if I didn't. Difference is, this time, you gotta hold on to that bedpan, because as soon as she rolls over, whatever was in there, feces, urine, doesn't matter, it's gonna be all over the bed. Okay, Melody, can you roll over for me?
Oh, as she rolls to hold on to it.
Mhm. You hold on to the bedpan as she's rolling. Matter of fact, you grab a hold of that bedpan before she starts to roll, because once she starts to roll, it's too late. Come back to me. Shouldn't have to pull it all.
Before she rolls. You need to hold it while she rolls.
I'm gonna cover it. Here's my toilet. I'm not leaving the room. Dump it. Rinse it. That goes in the trash. This would go back under her bedside table. She uses it every time. I would remove those gloves, wash my hands, put on my third pair of gloves. She wiped herself. She needs to wash her hands. I'm gonna give you a warm soapy washcloth. Can you wash your hands for me? Can you dry them? Dirty linen. One more thing I need to remove with my third pair of gloves on that might have bodily fluids on it. Just gonna remove the blanket, okay? Dirty linen. And remove my third pair of gloves. Wash your hands if you want, or finish up. Remove my third pair of gloves. Wash my hands. My side rail up. Would you like to have your bed up or down? Good. So my side rail up. Bed in the lowest position. Both side rails down. I'm gonna give you your call light. If you need anything, let me know. Remove privacy. Wash my hands. So do you understand the reason of changing those gloves 3 times?
Yes.
And you already learned that every time you remove gloves, what do?
Wash hands.
So if you didn't wash your hands at least 4 times, you didn't do the skill right.
Yes, Diana. When you leave the patient in the bed, to put the bedpan in the position, will you put the side rail up?
Yep.
When you,
When the
The privacy when she's ready to
yes,
use
the
it.
side rail's up. Even though you're not leaving the room,
You put it up.
you're just giving her a little bit of privacy. when we get to the nursing home, guys, there's some residents that like to be toilet.
That's what I mean.
She's
now.
saying when you raise the bedpan,
There you leave the
you're
patient,
supposed to
you
put
need
the
to
side
put the
hills
side rail
up because
I know,
you
Lisa said
moved.
side rail up
Yes.
to dump the bed.
Yeah.
Yeah.
Keep in mind, you're not leaving the room.
Yeah.
You're right here.
For safety.
Listen,
So for
don't
this,
don't delve so deep into it. If you're in the room with the resident, okay, and the bed's in the high position, put the side rails up if you're going to leave the immediate area.
so for the state exam, you don't have to mention that you're going to raise the side rail to go empty.
We're not
Clean it?
going anywhere.
Okay.
You gotta stop saying
I thought
going.
I thought the
Okay.
one
We are
guy put
never
it up
leaving
and she's
the
wiping
room
herself.
during denture care or bedpan.
Okay.
If I were to leave the room, I would have to put both side rails up, bed in the lowest position. If I'm turning my back to dump this, I'm right here.
What about when she's wiping herself and you give her the privacy and stuff?
I give her privacy to have a bowel movement, the side rails up.
Okay, that.
The reason for that is because if I get distracted, somebody in the next bed asks me for something, I'm distracted now. The side rail is down. Now I've placed her at risk.
Okay.
I'm not leaving her. The side rail's up. I'm giving her privacy. When I come back, I gotta put the side rail down to get her off the bedpan anyway. When I dump the bedpan, it's right here.
Yeah. Okay.
If you were actually taking care of someone and the bed was in the high position and the side rails were up, you could actually, this is a typical setup of the room at St. Joe's. So this could be a room and this could be her bathroom. You're still not leaving her immediate area. You're not leaving the room. But there's a potential when you give her privacy to be on the bedpan. She may be on there a half an hour. Some people have to take a bowel movement. It takes them a half an hour. In that case, you want to make sure that side rail's up in case someone else calls you to do something in that same room.
Yeah. Okay.
There's another person in that room. Okay? All right. If I made any mistakes, I'd still pass.
Because you wash your hands?
What I didn't do is make a mistake with anything that has to do with infection control.
I see.
They're not devils. They
But they
give you
boot.
the benefit of the doubt. The only way you can fail, guaranteed failure, is if you make a fatal error. What does a fatal error consist of? Not leaving them their call light. Not putting the side rails down when the bed's in the lowest position, or putting the side rails up when you're moving the bed. Not leaving them their call bell. Fatal error, not wearing gloves when you're supposed to.
Something like check ID.
Check ID. If you forgot that, she might pass you. But the reason I've repeated every one of these principles of care, every skill I've done, is so you won't forget. How can you?
Oh, so much.
Just don't forget any of them and you'll be all set. You won't have to worry about which one you forgot. I told you day one, most important thing you can get out of the class. 6 principles of care. Use them every time you do a skill. We'll get to the nursing home and I'll say, we're gonna get her out of bed now. Do I need to draw the curtain? Don't even ask. Yes. If there's someone in this bed and someone in this bed, why should this person see this person struggle to get out of bed? If there's someone in this bed and someone in this bed and this person's feeding herself, why should she sit there and watch me feed her? You draw the curtain for everything. It's called privacy. And everybody is entitled to privacy. Okay, think of yourself being in a hospital. And they come in to give you a bed bath. They got all your clothes off, right? And they turn around and leave. I'll be right back. And you're naked. Can you do
See all
anything
those
about that?
saggy boobies?
No, because you can't move.
Yeah.
They rely on us to give them privacy. They rely on us to communicate with them. They rely on us to tell them everything we're doing. Because if you don't, you're going to get someone like Marion, and everything you go to do, she so much as sees the gate belt. She'll say, what are you going to do with that? So you tell her, rather than her having to ask. We keep them informed. They have a right to be informed as to what we're doing. Just remember that. And ask permission. There's nothing wrong with asking permission. And then put the head of your bed up. Is that okay? What if she says no? Then I can't, can I?
No.
She refused, right?
Oh, if
Thank
you,
you.
if you do the bedpan and then you ask her, you're gonna put the head of bed on. She said no.
No, they have
Once
to.
you put her on the bedpan, you gotta put the head of the bed up.
You don't.
If she said no,
If
No.
she said no, I couldn't.
you have to wait until she decided. Like,
If she refused, if I say, okay, you're on the bedpan now, I'm gonna put the head of your bed up. She says, no, it makes me dizzy, then I can't. But that's not gonna be your scenario. What do we need to do repositioning? 3 pillows. Morning, Ashley. I'm Dianna. I'm gonna be your CNA today. I'm gonna help change your position in the bed. Is that okay? Wash my hands. Check ID. Provide privacy. Both side rails up. Bed at a good working height. And I'm not gonna put my side rail down because as I'm looking at you, you're gonna be too close to the edge of the bed. I'm gonna leave my side rail up. I'm gonna put her on her left side. I'm gonna put this side rail down. I'm just gonna move you over a little bit, okay? No, you stay there. 1, 2, 3. Two, three. This side rail up. Okay, we're ready, Ashley. Just gonna cross your leg over, okay? The opposite leg goes over. Give yourself a nice big hug. Use good body mechanics. Shoulder, hip. 1, 2, 3. You okay? Always the open end of the pillow at the bottom. I'm gonna put one pillow behind your back. Okay, you can relax. The next pillow, always the long way, always with the opening at the bottom. And with the last pillow, I'm just gonna wrap your arms around this pillow, okay? Check the pillow under their head, make sure that that's positioned right. I'm just gonna move this a little bit. How's that? You comfortable? I'm gonna put my side rail up, put the bed in the lowest position. I'm gonna put both side rails down. I'm gonna give you your call light. I'm gonna remove privacy. Call me if you need me. Wash my hands.